Good morning, Larimer County, and welcome to our February 5th, 2024 quarterly update. This morning, the Commissioners, we are convened as the Board of Social Services, and we will call this meeting to order at 10:01 a.m. My name is John Kafalis, Larimer County Commissioner, joined by my colleague Kristen Stevens from District 2. Commissioner Shattuck McNally will join us shortly, addressing some personal matters. We also have our county manager, Lorenda Volker, and a bunch of really smart people over on the other side of the table. Lorenda, is there anything you would like to say to cue up the presentation from Director O'Hare and her team?
I'll just say that you all meet quarterly with this group to get updates on what's going on in our human services areas. They have a very packed agenda, so I will not take any more time. But you all do meet regularly to talk about these issues and receive information about state reports and how we're doing against our peer counties. So Heather, I will hand it off to you to go through the agenda.
And actually, before we hand it off to Heather, just want to acknowledge that my colleague, Commissioner Shattuck McNally, Jody Shattuck McNally from District 3, has just joined us. Welcome.
All right. Good morning, Commissioners. Lorenda. So you have a packet in front of you. Any additions to the agenda? We will give a CCAP update as well as an options for long-term care update as part of the financial agenda item.
And it doesn't look like it's reflected, and we may not have time, but I raised the issue of access, uninsured, underinsured, and waiting lists regarding community-based health centers and people on Medicaid and so forth. And either we can touch on that or hopefully we can follow up.
Thank you. I think we can weave it into the second agenda item. All right, so we will jump in. Every February, we come to you with a semi-annual fiscal update as we are halfway through the state fiscal year. So this will be an update for our expenditures up through December 31st of 2023. And I'm going to hand it over to Gordon to walk through a couple of slides and just tell you where we're at across all of our allocations.
Good morning, Commissioners. Thank you for having us. As I jump in, Gordon Coombs with Operations Division Manager for Human Services. As I jump in, one thing I'll share with everyone is Carol Hartman, who is one of our budget staff, actually retired last week. So we have a new accountant on board, Amy Halig, who is overlapping.
Forgive me for interrupting. I'm noticing that the slides are not showing up on that TV. Can we make sure that happens so the public can see these? There they are. Please continue, good sir.
Excellent. So we're excited to have Amy on board to help with provide a fresh perspective on our budget and learn from our organization and our knowledge that we have with the team. So I'll jump in first with aging or adult protective services. So this is we are 70% spent on this allocation. Increased funding for this program is CHSDA and CCI budget priority. Adult Protective Services continues to be underfunded at the state level and results in us covering that which the state doesn't cover at the end. We have limited resources to maintain this long-term, so this is not sustainable for the long term, but it is a priority and we're working on that.
So I would just add that client services line item is the only one that we can control. So that is where we're helping to cover any direct services, maybe a home care provider or a chore provider that's not covered from one of the other programs in aging and adult services. So we always plan to spend 50% in the first part of the year so that we have 50% left for the second part. And then the Elder Justice COVID grant is ARPA funding that we receive for this program. And we have the approval from the State Department to spend that towards our admin line. So that's why it's not spent, is that will then get attributed to the APS admin line up above. It won't cover all of the overspending, certainly. And so the rest of that then will come from county-only funding, unless something happens with a supplemental at the legislature, but we're not hearing anything about that yet.
All right, moving on to child welfare. So overall, we're 58% spent on child welfare, with 80% spent in core, 73% spent in county staffing. With, as we've talked about in the past, we strategically overspend this allocation based on how other counties are spending theirs and to meet the needs of our community. The state covers overspending at the end of the fiscal year to some extent. In order for us to project that and predict that, we have to watch other county spending and also be on top of the state's projections and our own projections. In that vein, we met a couple weeks ago with Colorado Department of Human Services Chief Financial Officer to kind of go over the state's projections and help us model that and predict that a little bit better, and gain more information on the state's projections. But overall, we're trying to get a better idea of how that closeout is going to happen and how the state predicts that.
Yes, Commissioner.
Like, it feels like a lot of work for you to have to do that. Is there any effort at some point to sort of say, well, there's these counties, like for 10 years have not spent and these counties have had to overspend, and maybe we'll even things out a little bit or kind of do some smoothing and make sure that, and I see all the smiles, so I'm sure like that's, but I mean, it never makes sense that feels like so much extra work for all of you to do that.
It's a great question. So many other counties are often underspent because of vacancies. And so because of a staffing shortage or a lack of services, they are underspent. So they are constantly trying to spend more, identify how they can, address the workforce issues. So it is not often the same county over and over again that's underspending. The other piece that I would add, we are very grateful to all of you that you allow us to overspend allocations. Other counties aren't as lucky, where their board gives them a very clear directive that under no circumstance can they overspend allocations. And so as they're trying to spend as much as they can but not go over, sometimes that drives underspending in other counties. And the closeout process strategically helps us provide services to our community that our allocation can't fund. And I would say we are more overspent this year than we're generally comfortable with. Thad and I are watching this very closely. We are concerned with our spending and concerned with there is a lot of legislation coming in child welfare, as you'll hear from Stuart in a little bit. But some of that legislation is also looking at reducing the block funds for 3 years to pay for a strategy for high acuity youth. So it's constantly a moving target. But I'm concerned about the spending. We have 8 vacancies that we've put on hold indefinitely to try to produce vacancy savings for us, and we're still more overspent than what I'm comfortable with. So we're constantly watching the spending of other counties. But I do anticipate that we'll have to spend quite a bit of time at the end of this state fiscal year this summer, really looking at our spending for the last year and likely having to make some difficult decisions moving forward.
Thank you. Commissioner Shattuck McNally.
Thank you, Mr. Chair. Good morning, everybody. Sorry, I have an ill family member that I had to decide if I was going to take somewhere or not. So part of life as a caregiver. I am wondering if you're tracking all this time and effort, and so that if we need to make the case of needs and, I hate to use the word wasted energy and efforts, that we can start talking and planting seeds with our legislators, that this is really kind of the uncertainty and now projecting some issues, it really, in my opinion, puts a lot of stress on you all, but also makes this harder for us to deliver services and take care of our residents in need. And so I think that's an important narrative, and so I'm curious, I'm sure you are, but I think as we get to that point, if we need to start advocating on different levels of federal or state level, we have some of these concrete stories. I'm wondering if you, and that's another thing for you to have to do, but I'm sure if it's happening, you could document it, and I'm just curious about that.
We do have, so we track this very closely, also the workload. And so with every new piece of legislation, part of Stewart's role that you'll hear more about in a little bit is to also help us capture what the future workload impacts might be. We have fantastic staff that are split across all of these funding streams. So we track it very closely, but we also have a handful of presentations from the counties collectively to the JBC this year that I think will be really beneficial, particularly in child welfare. I know there's one tomorrow. There's one coming up in later February as well. So there have been a lot of conversations with the JBC members in particular, and then we follow up with our local delegation. But yes, we have plenty of tracking and stories if it would be helpful.
Yes, since I talked to some of those folks on the JBC, it might be nice to have some of that in my back pocket for when I'm down there and have someone, hey, let's go have a cup of coffee, and I can have conversations and reinforce your message. So thank you.
We will get it to you. Thank you. Just the last piece before we move on to the Child Care Assistance Program. So the very last line item there, SFCP, is the prevention grant. So we are in the last year of the prevention grant. That funding ends at the end of the federal fiscal year, at the end of September. So we are actively working on a sustainability plan, trying to determine what happens with that, as it's provided a great benefit to the community. Right, we can move to CCAP.
All right, moving on to CCAP. We are 56% spent on CCAP funding. CCAP freeze was instituted February 1st. I'll let Heather talk more to that.
So the freeze was approved by the State Department of Early Childhood. We have a press release that's going out later today to inform the broader community, and then we have some targeted emails out to community partners. But we did go onto a freeze last Thursday. So what that means is as families come off of the program, we won't be adding new families on because we're anticipated to be between 600,000 and 700,000 overspent at the end of the state fiscal year. I also believe that unfortunately we'll likely have to carry the freeze into the next state fiscal year come July because significant ARPA funding is ending at the end of June, which will decrease our allocation from about 8.2 down closer to so we would go back to the 6.4 million, and right now we're projected to spend about 8.8 million. So if something doesn't change, there is a budget request into the Joint Budget Committee, but the budget request doesn't cover all of the ARPA funds that are going to end. There will still be a gap in what the ARPA funds are providing today. So we will see what our allocation is going to be for the state fiscal year 2024 into 25, generally around the end of March.
All right.
So, excuse me, I'm trying to be mindful of the time, but it's a little bit difficult since these are important matters. So hopefully you can help us to keep on track as best as we can. But what you just shared, Heather, ultimately less families will be served. And there is a structural fiscal imbalance here. And other than a request, is it supplementals or are we expecting additional CCAP funds in the next fiscal year at the state level? And can we anticipate any additional federal dollars, Child Development Block Grant?
Those are all very good questions, and a lot of unknowns. So this is one of the programs where we have the opportunity to purchase, if you will, to approach another county that is significantly underspent and say, can we pay your county share? I already have 5 other counties that have committed to working through that process with us. So I'm hopeful that the 700,000 overspent will be entirely covered, and all we'll have to pay then is the county share portion of that. But in terms of your follow-up question about do we anticipate more funding, we won't receive. So right now we're receiving. I apologize. So the total funding, the 8.2 million, is what we're receiving in totality today. 6.4 million, a little over 6.4 million, is our normal CCAP allocation. And then the CCDF CARES funding, that's ARPA funding that was earmarked at the federal level for early childhood programs. So we're receiving a little over 1.7 million in ARPA funds today that is going away. The State Department has asked for a budget request to help supplement some of that in state funds, but not all of it. I think in total, there's about 40 million across the state in ARPA funds. And I believe what they've asked for is 24 million. So we might see a little bit of a bump on top of our 6.4 base allocation, but it won't get us all the way to the 8.2 that we're receiving today. And there's a lot happening at the federal level. There's a lot of rule changes coming to this program. The state is also getting ready to submit their next state plan for this program that I believe is due in May. So we're working with the state on the state plan, but you'll also hear about some potential legislation coming that will disrupt the financial structure even more potentially. So it is a program that we're still not strategically finding a way as a state to serve more. We're still only serving about 9 to 10% of all of the kids statewide that are eligible.
Thank you.
Moving ahead to TANF, we are 53% spent on that, so we're a little over for 6 months in, but doing pretty well. Going on to CSBG, the Community Services and Block Grant, that is on a calendar year, and that was fully spent at the end of the calendar year. County admin, again, we're a little over, but about halfway there, 6 months in. There's as a result of legislation in 2022, a workload study that to evaluate county admin and adjust those costs and allocations.
And this is the allocation, I believe you mentioned at the beginning, Commissioner Kafales. There was a one-time infusion of state funds just shy of 17 million last state fiscal year. That money ends. And so for us, that was about 850,000 that we received of that total pot. And unfortunately, the governor's budget request to the JBC did not include continuing with that funding. So we are planning for a statewide reduction of about 17 million that would hit in the, I believe it is entirely CDHS county admin. So the 2 state programs split this funding stream because this helps us pay for, you'll receive a great update from Vanessa on the next agenda item, but this helps us pay for the staff that are processing the Medicaid, the food assistance, and other public benefits programs. So we are watching this very closely and will likely be looking at our vacancies in this program in the next couple of months.
Thank you.
Moving on to Employment First, we are only 8% spent on Employment First. Challenge with this program is it requires a 50% county match. That's why that funding is where it is.
And this one also runs on a federal fiscal year. So this calendar just restarted in October as well.
On to Office on Aging, we're right on target, a little bit below, 47% spent so far. in Office on Aging with allocation was reduced in 2023, 2024. So we're a little overspent at the Office on, or that line item in Office on Aging. All right, options for long-term care. So this program is ending, as you all know, ends February 29th, and we have an updated number on the payout, the layoff payout. That is $300,975.
So this team, we have about 50% vacancies right now. We haven't added staff back to this program when we learned we weren't keeping it. So the 19 or so staff that we have will be laid off at the end of February. And they will then receive a severance package from the county that in totality, like Gordon said, is a little over $300,000. The challenge with this program is we are still waiting on payment dating back to December. And what we've learned from healthcare policy and finance is that they intend to shut off our access to the system on February 29th. So we are very rapidly gathering all of the data, gathering everything that we can before we lose access to the system to then be able to dispute the payments for probably the next 3 or 4 months to come. They overhauled the case management system, and there was some discussion about this at the Colorado Counties, Inc. Legislative Steering Committee. The case management system, the data accuracy and the functionality issues they're having in the system is significant, which that's how we get paid. So Lori and her team are tracking this very closely. We're disputing the payments. Sometimes they are upwards of $50,000 short each month. So we will continue working on this even after the staff have left to make sure that we get paid what we are owed for the work. And we also have a very small pot of deferred revenue, some grant funds that they provided to us for similar activity that we'll use if we have to, but it won't cover everything that we anticipate we'll have to dispute. So we'll still have this on our agenda just to give you an update at our next meeting in May, even though the staff will have transitioned. And it sounds like most of them, some of them are going to Weld County as they're expanding their program, and some are going to Foothills Gateway. So we're very grateful with the work that Lori has done with Human Resources and Foothills Gateway. All of the staff have secured employment that wanted it. Some of them are going to stay home with their children. But those that wanted to stay in this line of work have secured almost the exact same job, but either with Weld County or Foothills Gateway.
Yes, Commissioner.
Thanks for that update. I'm still saddened to hear about all of this. I'm curious, as we go forward, there's still going to folks who are still going to be calling and thinking this is where to go. So that takes time and effort. But they're cutting us off at February 29th. So what's the plan or what's the messaging to help steer folks either to Weld County or to Foothills Gateway, and how, because we might get calls, and I'm just curious about that.
Sure, I'm happy to answer that. Lori Metz, Division Manager, Aging and Adult Services. So I've been meeting with Foothills Gateway regarding this transition for almost on a weekly basis for about 2 months. And with Jill's communication team, we've worked out a plan where information will be updated on larimer.gov about where to go to find information about this program effective March 1st. We're also going to be utilizing technology to have announcements on voicemails and common numbers that are out there in the community to reach this program. And also we'll have bounce backs on all of the emails that will be vacated once these folks are gone to direct people to Foothills Gateway. So as part of the transition plan developed by Healthcare Policy and Financing, we've actually sent out letters to all the providers in the community, sharing with them who the new agency will be effective March 1st, and Foothills Gateway has done the same. And we've sent out 1,500 letters to all of our active clients as well. So we've done what we can do to kind of share the information, but we do anticipate, particularly on Vanessa's team who are answering those phones, that we're going to be getting calls for some time. So being able to share with them where they can go and get those services.
Thank you.
Of course.
We can make sure that your staff also has the talking points, the websites, the phone numbers so that if calls come in directly to you.
Very quickly, Heather and Lori, is there a particular, if we get inquiries specifically to the commissioners, who should we refer folks to, Lori or you perhaps, or, I mean, sometimes we get people who reach out to us.
You can send them to either of us. And for anyone living in Larimer County, Foothills Gateway will be the new agency. Just some of our staff are going to Weld for employment, but Foothills Gateway will be the new service provider.
And my second quick question is, do you think there would be value to the 19 people that are being laid off if there was a letter of appreciation coming from us, or would that not add a whole lot of value to what they're going through based on, the work required to draft a letter that we could sign off on?
I think they would appreciate anything and everything. I think I was sharing with Commissioner Shattuck McNally, anytime you give praise to our staff in these meetings or in admin matters, we take that snippet of video and we send it out to staff so that they see it right away. I think they would appreciate anything and everything, and we're happy to work with you all if there's something you want to give to them before.
So could you folks draft something and try to get it to the 19
Yes.
staffers?
We definitely can.
Thank you, Heather. Please
Thank you.
proceed.
And last but not least, Andy Navigator. We are underspent there, 34.7% right now. Go ahead, Heather.
So this is a program that we have presented to all of you a couple of times now. It is providing a fantastic benefit to our community. There are well over 100 individuals that the two staff on Lori's team are helping to navigate Social Security benefits. They're currently receiving the Aid to the Needy and Disabled, terrible name, but that's what the state calls it. So it's a state benefit that is intended to help give them some financial assistance until they transition to their federal Social Security benefits. And unfortunately, this program is slated to be eliminated. It was not continued in the governor's budget, even though it is ultimately saving the state a lot of money, because when the individual receives their federal benefit, there is a payback to the state for some of the state benefits that were paid out before. So we have shared this with Senator Kirkmeyer, who is our Joint Budget Committee representative. We've had some conversation with Senator Janal as well. We've just recently learned that the intent is to repurpose these funds into a state level office for disability services. We don't know the detail on that, but I also have just recently received the contact from the governor's office who is working on this transition. So we're hoping to get some more information through CCI or Colorado Communities, Inc. To find out what is going to happen. Unfortunately, this is one of the programs that was significantly underspent statewide. We were spending it so well and had figured out a way to utilize the funds that they more than doubled our allocation. But unfortunately, they're not planning on keeping the program going long-term. So it's one of those, to your earlier question, when it's not being spent, the state may reuse those funds to provide the service in another way. So Lori and I, Katie Stieber on her team, and Jill Mosh met just last week to do some strategic planning for these services, for other services in Lori's division. And so we're trying to determine then what will happen to this program locally, and is there potentially a way that we might be able to keep it without the state funding? So we will keep you updated as we learn more, both at the state level and in our internal exploration. So that is the last of the fiscal piece. Any questions on that before we shift
Colleagues, this would be
gears?
an opportunity if you have any additional questions on this part of the agenda before we move into the next part. I'll ask a quick question again. Would there be any value of me raising this issue with the State Board of Human Services to get more specific information or answers to questions? Or I know we have a good relationship with Senator Kirkmeyer. I wonder, with Senator Zenziger, my relationship with her would be helpful.
I certainly don't think asking the question in state board would hurt. But I do, based on what we heard last week, it sounds like the decision was made directly from the governor's office. And so it sounds like it is also out of CDHS's hands. They plan to open a new office in the Department of Labor to serve this population. We don't have any additional details on what that will look like at the local level. So Katie First from CCI connected me with who from the governor's office is working on this, and we haven't seen a bill yet, to my knowledge, that will reallocate the funds to the Department of Labor for this new program.
Thank you very much, Heather. I think we can now move on to the next agenda item, get some updates on food assistance and healthcare assistance programs, and we have Vanessa.
So transitioning to this next update, so we have shared with you over the last several months about the changes to the public health emergency, the impact of that to the Medicaid recipients, as well as the increasing utilization of food assistance. So this is a presentation I was sharing with Commissioner Kafalis. This is one that was provided at the Legislative Forum from the Human Services Directors Association to legislators that attended. And Vanessa's going to walk you through, she's overlaid Larimer County's specific information so that you'll see the context of what's happening statewide that we certainly are feeling here locally.
I can drive, thanks. Good morning. I want to make sure my light's on, yeah. Vanessa Fuel, Division Manager with Benefits and Community Support Division. Good morning, Commissioners. Thanks for allowing me to talk this morning about the providing an update on the Medicaid and food assistance program. So this morning, you heard in the budget conversation that we are watching closely our county administration funds related to that ties directly to the people who process the applications, redeterminations, and changes for individuals who are on these programs. I'm going to talk a little bit about some of the federal changes that have impacted both our workload and the caseload, so both the people who are doing the processing and the people who are receiving the benefits under both Medicaid and food assistance. And then talking a little bit about the complexity of the job of determining eligibility and the knowledge base that our community support specialists need to have to be effective in their role. And then the challenges that come with that. So to orient you a bit to the Benefits and Community Support Division, we provide, we determine eligibility for Medicaid and food assistance, also known as the Supplemental Nutrition Assistance Program, or SNAP. Medicaid is also referred to as Health First Colorado. So you'll hear those used interchangeably. They refer to the same program. We also have adult financial programs that Heather was talking about with the A&D program and other cash assistance, including temporary assistance for needy families, and our child care assistance program. So here I'll be zeroing in on Medicaid and SNAP. So just to give you a little bit of background on how we got here, going back to 2014, January of 2014, when the Affordable Care Act was implemented, at that time, we were allowed to passively re-enroll people in Medicaid, which meant that the county didn't have to do anything to keep people on their Medicaid. For the most part. There are certain circumstances that come up where the case needs to be reviewed by someone, but by and large, this caseload was just growing. They expanded Medicaid to a wider population of people. The eligibility criteria grew, and the county didn't have to do a whole lot to keep people on the program. So then in March of 2020, the public health emergency began, and that was the time. At that time, we had the emergency allotments for SNAP, or what we referred to as max allotment. And then we also had people who were locked into Medicaid coverage. So those folks who were no longer eligible were allowed to maintain their eligibility for Medicaid. Then in February of 2022, there was a federal policy change to Medicaid renewals, which now required action by the client and the county. Shortly thereafter, another year, I suppose, March 23, The SNAP emergency allotments ended due to congressional action, so that happened, I believe it was part of a continuing resolution where the SNAP emergency allotments ended. And then in June of '23, that was when the unwind of the public health emergency began for Medicaid. So folks who were no longer eligible, month over month, were coming off of the program. So this is this slide here is related specifically to Medicaid, and it shows on the chart on the left, shows the caseload as it was growing while folks were locked into Medicaid. And then you can see there going from state fiscal year 2022 to October of '23, a sharp decline. And this is when we started disenrolling folks from Medicaid who were no longer eligible for Medicaid. The slide that you see here on the right shows the impact to the workload. So even though the caseload is going down, the workload has increased because people need to now do something to stay on the program. Usually when a caseload declines, the workload declines with it. In Medicaid's case, that has not been true for us. So this is the statewide view. And when we look at Larimer counties, if you look at this ridge line, it follows the same pattern that the statewide pattern follows. So this is the month-over-month view, starting in 2020. You can see the box on the left side shows where continuous coverage begins, where continuous coverage ends there is in the 2023 column there on the right. So we've since May of 2023 through, this one goes through January of 2024, have seen a decrease of 17% in our Medicaid caseload. So that's just over 9,000 cases.
Can I speak to Kapal's question about uninsured?
Sure. Unless you want to.
Thank you. A question is, so those 9,134 individuals who had Medicaid for their health care coverage, what are they doing now for health care coverage?
So these are folks who throughout at some point during the public health emergency got a change in their household income. So maybe they got another job that put them over income. So for these individuals, we would refer them either to their employer. They may have a health insurance option through their employer, or to the exchange. And so locally, we refer people to Larimer Health Connect because they can help folks get out onto the exchange. They'll have their Medicaid denial that then serves as their eligible incident. I can't remember what it's called, you know. You know what I'm saying?
Oh, a change in status.
Yeah, right. Qualifying event, thank you. Yeah, they don't have to wait till open enrollment is what that means. When they have their Medicaid denial, they can go out to the exchange and get health insurance that way. So those really are the options that are available to people. And our specialists are versed in communicating with clients on where they can go to access health insurance.
I think the unfortunate part is that that doesn't mean that they have secured another insurance option. They may choose not to pay for the insurance either through their employer or to find another plan through the exchange. But ultimately, they're not eligible for Medicaid based on the federal requirements. And so there may be a portion of this 9,100 that don't have insurance today, and those that have insurance may still be underinsured based on the coverage that they've secured. So it is still an access issue in terms of services, but unfortunately, they're not eligible for Medicaid, and so our hands are really tied then on how we might serve them, other than, like Vanessa said, referring them to their employer for insurance or the exchange.
And just to comment on the question around access then, for those individuals who are still on Medicaid, if they are trying to find a place to access their medical services, we would refer them likely to their regional accountable entity, which for us is Rocky Mountain Health Plans, because they are the ones who know which providers take Medicaid and which providers don't. So they're a better channel to say, this provider has capacity to take new Medicaid clients, and they could do that referral. So that's typically our first step that we offer people, is to contact Rocky Mountain Health Plans.
And perhaps a question for later, or the parking lot is recently received a communication from the Behavioral Health Administration regarding the establishment of one of our favorite acronyms, BASOs, Behavioral Health Administrative Service Organizations. And looking at the map, it appears that we are in a particular included with Weld County, which is different than what we had before with Rocky Mountain Health Plan. So I guess the question there is, what are the implications for that? But we don't need to go there right at the
It's a
moment.
very quick answer. So healthcare policy and finance plans on redoing the Ray regions. They are going to put it back out for a bid for a new competitive process. So the Ray regions are supposed to align with the BASO regions, and then we would have the same regional accountable entity as the BASO. So they're redrawing the region boundaries, but then also there will be a competitive process to reselect the Rays.
And having the medical care and the behavioral health care aligned, those regions, that's a good thing.
Crucial.
That's a good thing.
Yes, it is. It will be crucial so that individuals who have Medicaid can receive better navigation of behavioral health, mental health, and physical health services.
Great, thank you.
Thank
Please
you.
proceed, Vanessa, you're doing a great job.
Thanks. Appreciate that feedback. Okay, so moving on to SNAP. So this is back to the statewide view. And again, want to thank our partners in our neighboring counties who have worked really hard to put this data together. I borrowed this from their presentation. So for SNAP, which differs from SNAP, is the Food Assistance Program, Supplemental Nutrition Assistance Program, which I will now refer to as SNAP going forward. So while this caseload was in no way locked in, right? So these folks have had to continuously reapply to maintain eligibility of these benefits. You can see there's been a steady increase statewide. So because this chart shows you kind of the high points of an annual fiscal year, I'll show you a little more of the nuance in Larimer County when I get to the next slide. But overall statewide, we have seen a 26% increase in the SNAP caseload from state fiscal year 2019 through November of 2023. Oops, that's the wrong one, sorry. So this is the Larimer County view. Showing here, if you follow the ridge line, again, you can see that steady incline that really started in the beginning of 2022. So this chart takes us through December of 2023. But since the beginning of 2019 through the end of 2023, we've seen a 56% increase in our caseload. And you can see the box there on the left with the arrow pointing in shows when max allotment began. So you can see that it didn't follow a consistent upward line when max allotment began to when max allotment ended. The bubbles that you see down below are some things that we think are additional impacts to what was happening in people's lives that determined whether or not they were driven to this program. We had an eviction moratorium, we had expanded unemployment insurance benefits, emergency rental assistance, and the ARPA Advanced Child Tax Credit. So collectively, we had a more robust social safety net with those additional policies in place. And as those COVID-era policies ended, we started to really see a rise in our caseload. The other thing that has happened is our community partners have gotten really well-versed in application assistance. So we have a really strong partnership with the food bank and with Colorado State University that has, I think, reached an expanded population. They are able to assist people with applications through Peak Pro, which allows a community navigator essentially to fill out the application on behalf of another person versus Peak, which requires the individual to submit their own application. So that really gives people access in a different way to this program, but also just recognizing that inflation has been an impact to people's pockets. And perhaps when they were seeing there were these other safety nets in place, they had more household resources. And as those policies have gone away, they're saying, I need some more help. And then they come to the SNAP program. So we hit a record 18,000 cases in this program in December. And I did check, it went up again by about another 50 cases in January. So we're continuing to see an increase in this program. Those are households.
Thanks,
Yes.
thanks, Vanessa. Commissioner Shaddock McNally.
Thank you, Mr. Chair. I'm glad that more people are getting access and qualifying. It's disheartening to see such a large increase, but then we know we're also serving folks that are getting hungry. I'm curious about tracking numbers when you talked about Rams Against Hunger and some of the stuff happening at CSU. I was talking to some of those students over the weekend, and they want to do something, so I'll be connecting with them. Heather, just a heads up. And so, are we tracking, and maybe this is uninformed question, so I apologize, but the percentage of older adults versus families versus maybe the 18 to 23, the student population, are we tracking, breaking down those as well, or maybe veterans and seeing kind of who, where, what, so that if this very layered social safety net is gone, maybe there's other services we could bring in to kind of build that stronger net at the bottom. Am I asking the right, am I making sense with my question?
Yeah, I think so. And thank you for the question. I don't have a breakdown of the age ranges or the household types. That's something that I think we could look at with our data team. Want to thank the data team because it's because of their work that we're able to create charts like this, because they're able to pull that data out of the back end of CBMS. So I think that we could look into that to see if there's a way to get those household views.
The reason I'm just with thought, and again, I'm not the expert, you all are. For example, older adults, if we also need to invest more into Meals on Wheels, we know a certain Meals on Wheels program to another area of the state shut down. I'm assuming that increased the need for food for others. If we are seeing an increase of students at Front Range or other community colleges or CSU, there's a need there, then we can, I just feel like it would help us know. And also, it might just be a snapshot in time. It might be one area this time, and then in a year change. But at least we can get a picture of who's going hungry. We have folks like Kids Pack who are trying to help students, and they're seeing an increase, tremendous increase. So I hear stories from these agencies who are trying to address this. It sounds like everyone's seeing an increase, but I'm wondering what if we were tracking that. I appreciate you listening to my rambling. Thank you.
So we can look at different populations. There's a couple of challenges. One, we don't have access to the data anymore that we had. I think 2019 is the last time we had it, when we were able to look at a report from Hunger Free Colorado that said the total population that are eligible but not enrolled in the program. We don't have access to that data anymore, which was always a good gauge to know where the gap is. The other piece, though, we have heard a lot, and I think in March of 2023 is when we heard most from older adults that the amount of benefit they receive, which is set at the federal level, isn't worth the administrative hoops that they have to jump through to continue to receive the benefit, which I think is very valid. I think it's just over $20 a month that they receive. And so the time to go through the paperwork to keep those benefits going. But we can look at the different populations and see if we're seeing different trends. It's just hard to compare that to something when we don't know the total population that could be eligible for the benefits. But we certainly can take this and dig in more detail and bring it back.
Thank you.
Just have a couple of questions, thoughts. First of all, I want to reaffirm what the commissioner said. I think it would be really critical to get as much detailed demographic trends as possible, because that could help inform any policy changes. So I think that's critical along ethnicities, age, gender, gender identity. I think as much of that. And I would think that I don't know what, I haven't looked at the Community Health, Wellbeing, and Resiliency Dashboard. I know there's a section related to food insecurity. I don't know what information is on there, but somehow I'm hoping we can put this kind of information on there as well. And I thought as we were looking at internally, sharing appropriately different databases, that was helping us to access more information other than what's available from Hunger Free or American Community Survey and that kind of thing. So just want to reaffirm what I think probably the three of us agree would be really helpful. Second question, that's more of a statement. My question is, I know it's not referred to as the participation rate. There is all of the state agencies like to come up with all kinds of acronyms. But what, this particular graph, how does that align with an issue that we've tried to do a better job in the state of Colorado, and I believe in Larimer County, as far as people eligible to access supplemental nutrition assistance programs but aren't, and one reason might be it's not worth it, but I wonder how have we increased the participation rate or whatever CDHS, Human Services calls it, and how does that track with this stuff? So that's my question there.
So that's the data point that I was referencing that we don't have access to anymore. CDHS wasn't tracking it on their own. It was a federal measure that we don't have access to. And our understanding is that it was an agreement between CDHS and our federal office, and it was a very manual process for them to provide the data that they weren't able to continue. So we can take it back to CDHS through our subpack groups and see if there is any additional data. Hunger Free Colorado isn't publishing it, so we can take it back and see what we might be able to get. Otherwise, we're stuck in trying to compare. So we have the free and reduced lunch population from the schools. That's pretty well established. But otherwise, we're trying to take this data and compare it to just broader poverty metrics, which are generally lagging real time. But we'll do some work on it and bring it back to you all with some more detail to it.
Perhaps at the May meeting, that would be great to have more
Yes.
robust discussion about these issues. I have a third question that's more playing the devil's advocate, but I think I will wait and see if time allows at the end to ask my question. That's more of a philosophical question in the role of devil's advocate. I will hold off.
And we're fine on time, so.
I know, but in the past, when we've said, done a check-in, and we say we're fine on time, sometimes things can unravel a bit. So I will hold off on my devil's advocate question out of respect for everyone. We can now move on.
Okay, so moving now from the caseload size, the people who are receiving the benefits, to the workload side, the work that we have on hand to process benefits for that caseload. Okay, so again, our partners in Weld County have done an incredible job. Every month, they collect the work on hand data of the big 11 counties, which makes up the majority of the state, to see how much work do you have on hand right now. Do you have, how many applications, how many redeterminations, how many changes? Then they also ask us, how many positions do you have? How many of those positions are vacant? How many folks are in training and how many fully staffed? Those numbers determine how much we can get done in a day, a week, or a month. And as I'll talk about the complexity of the work, it takes really a full year for someone to get into this job, learn all of the programs, the policies, the procedures related to it. And so it really does matter how many folks we have in training versus how many are fully staffed to determine whether or not we can meet the need of the community at a given time. So collectively, our workload has increased 137%. From November 21 through November 23. And I don't have a Larimer specific slide, but I will say that we follow this same pattern. So I want to talk a little bit about.
One moment.
Oh, yeah, sorry.
No need to be sorry. I believe I saw a finger up from
Yeah,
Commissioner
it
Stevens.
was, I was trying to be subtle. I don't know if I succeeded, but my question is with this work, the workload, is this SNAP and the Medicaid together? Okay.
Correct. So as we talk about the work that the community support specialists do, and we did change their title from eligibility technician to community support specialist last year, because we feel that the community support specialist title really more accurately reflects not only the technical nature of the job, but also the interpersonal part of the job. As we are talking about our community members in need, this is our frontline staff who are asking those intimate questions about their household finances and trying to navigate them through these programs as best as possible. So a lot of the people who are coming to us on a very bad day. So just in looking at the different program areas, the Colorado Department of Human Services, or CDHS, has over 468 pages of regulations for these programs. I was astounded when I saw that number. It really speaks to the literal volumes of content that have to be sifted through in trying to make an accurate eligibility determination. From 2020 through to 2023, these programs have seen 44 rule changes. 137 memos have come out in that same time period, and CBMS has had 173 projects. So what this describes is the moving targets around the work all the time. These are highly politicized programs, so the rules are constantly changing. And our staff then have the responsibility of knowing what those rule changes are, following those changes in the system, and getting it right for the person that's on the other end of the phone for them. And that's a real challenge. So moving over to the Department of Healthcare Policy and Financing, so this is the Medicaid side. There's 170 pages of regulation in Medicaid, 30 rule changes from 2020 through 2023, 143 memos in the same time period, and 98 CBMS projects. So Medicaid is no different. And these two entities, these two state departments, aren't always working together as they are looking at the rule changes, as they're thinking about the communication that comes out. And we're then tasked with trying to make sure that our staff have the accurate information in a timely manner. And we have an excellent communications team that supports us as best they can with that. But it really can get confusing for a worker to know what's happening is this a federal policy change? Is it a state level change? Is it something we've made a decision about at the county level? And when we get the questions back from our staff, it's clear they don't always know, like, where is this change coming from? Why is it happening? And we may not always have all of that information either as we're trying to address questions that we have. So we do our best to sort all of those pieces when someone comes and says, why is this happening? It doesn't seem fair to this person that I'm going to talk to about it in my next interaction. So getting into the training, as I was mentioning earlier, Commissioner, do you have a question? You just had a look. Okay. Getting into the training, as I mentioned, it takes about a year to get fully trained in this work. So you get your formal training that really is the policies, or those instructor-led training sessions that they have. And then there is the real-time practice with a lot of over-the-shoulder support. We have a training team who is solely dedicated to pretty much our new staff. They do some ongoing trainings for us, but really they're making sure that new staff are getting as robust training as they possibly can. And then once they complete their over the shoulder support, then they are with their teams full-time and still getting ongoing support from their manager and their lead on that team. And even beyond that first year, as you can see, the changes keep coming. So they are continuing to be trained on all of the changes that will continue to happen in these programs. So for training, there are 364 desk aids and process manuals to support someone if they're sitting down working with someone to be able to look that up and find their answer. 313 web-based trainings, 108 instructor-led events, and 132 additional videos for support. So I think that this role has in the past been really been simplified as a data entry position. And I think this highlights that that's just not the case. It really is some of the most complex accounting I have ever seen someone do. And I'll share, I have never been an eligibility community support specialist, but I have shadowed and I have watched them, and it is artful and masterful when someone who really understands how to navigate between all of the different systems to get to an end result and do that with high quality customer service, which is ultimately our goal.
Any questions or comments at this moment, colleagues? Yes, Commissioner, yeah.
Yeah, so, how hard is it then for community partners who are working with this, like SNAP? Do all these changes make it tricky for those people to stay up with what's happening? What does that look like for them?
Yeah, that's a great question. So we meet quarterly with our partners at the food bank and at CSU, who are the folks who do the highest level of support right now in our community. And interestingly, they are near specialist level knowledgeable because that's what they're doing full-time is application support. So they come with very technical questions to those meetings. We do a lot of the high-level, strategic conversations, and then they will come with case-specific questions to ask our staff to make sure that they're supporting people in the field as best they can. We also have a number of direct lines that if they're in real time working with someone, they don't have to wait for those quarterly meetings. We try to communicate changes. We also get them connected with the different subscriptions that you can be a part of so that you can get that information as well. But we get inundated, as you can see. So it can be hard to follow. Sometimes they'll say, oh, I got a notification of a memo. Can you help us parse through that? So we help to support them in that way. I will say, though, we are digging into the data around the level of support that they're offering. And for both those entities, CSU and Food Bank, they deliver us such high-quality applications. Over 50% of the people that they help get approved. So they know what they're looking for. They know how to navigate someone through the system, and they know how to get the proper verifications and deliver a high-quality application to us.
Do they have full-time people that are just doing that? Is that what you're saying?
Yes.
And with CSU, is that for students and staff as well?
Yes, it's through the Student Case Management Office,
Okay.
and they support the entire CSU community, not just students.
Okay, thank you. Well, I mean, that's great to have such good partners that are so diligent about making sure. So that 50% acceptance is pretty high then? Or above
Yes.
50%? Yeah.
Yeah.
Because there's a lot of people that don't get those benefits. And what would be the most common reason somebody wouldn't? If
They're
they
over income.
Over income is really, okay, thank you.
So just a quick editorial comment, and then perhaps a question that is somewhat, has an element of cynicism embedded in it. My editorial comment is to reinforce what you said earlier, Vanessa. A couple years back when we did the Bridges Out of Poverty training, and it was a big gathering of folks, and I had the privilege of sitting at the table with eligibility technicians, and it was a very eye-opening experience to learn what their, well, I don't think you can have a typical day. So I just want to reinforce and reaffirm that their work is not easy, and I got a little bit of a better understanding when I was able to sit at the table with them. That's my editorial comment. My question that has some element of cynicism, perhaps, and that is, in the last 16 years, since I've been in the legislature and been a county commissioner, how much state money have we spent on CBMS, Colorado Benefits Management System?
Millions, so much so that I couldn't tell you how much total. The reason that we have all of this data, so as Vanessa shared, our Weld County partners have helped gather this. Commissioner Scott James sits on the CBMS Executive Steering Committee, the exact same role as Commissioner Stevens on the trails.
Yep.
So not only is it the millions, and it is
Big.
multi-millions, that has been spent to improve the system, we then have to wrap around all of these other processes in executive steering committee and different work groups to keep the work on track. That is another added workload to all counties in addition to just the actual dollars to improve the system.
Thank you, Heather. Thanks for bringing the answer back to why it's important to ask a question like that, how it impacts folks on the ground. Thank you very much. I think we have one more slide, Vanessa, and then we'll move on to legislative matters.
Yeah, final slide. Thank you. So just to further highlight some of the additional challenges that come, not just the complexity of the job itself, but we do hear from staff about the change fatigue. And again, not knowing kind of where changes are coming from or how to digest those changes, or just the fact that it's another one, can be really difficult for staff. The system complexity and whether or not the system itself works, the CBMS system. So to your point about those changes, sometimes a change is made in the system. We show up the next day, they said we did a build overnight and now something doesn't work. And we're getting errors, and that impacts what we can do on any given day. We see that there are struggles. Oftentimes, we've got clients who are applying through the PEAK system, which is that client-facing system, and we don't have that same view. So there can be sort of a misalignment when you're trying to work with a customer who's saying, but I entered this in this field in PEAK, and our specialists are saying, I don't know what that means to me in CBMS. So the way that those data points map over can be a real challenge to try to get to the bottom of what might be happening with a case. Misalignment in program policy, SNAP and Med don't always line up with one another. So we find that we are often advocating for, can we use the same documents that we receive for a SNAP redetermination for a Medicaid redetermination, as an example? Oftentimes, they want their own processes for each program area that can, again, at the client level, be a real frustration, and then the staff level as well. We have to always be looking at production in these program areas, right? How much work can we get done in a day's time? Because the community need is there. And that can be difficult when it feels like the programs get more complex. And so each individual piece of work is more complex, and we also see a rise in our community need happening. So those production expectations of a staff member can be a struggle. We see secondary trauma in this staff population. Again, they are talking to individuals who are in a hardship time in their lives, and they might be getting far more of that story than just what they need to determine eligibility. So that secondary trauma and stress comes with this role. And I think about this one a lot, constant demand. It doesn't let up. So we have to really, in this division and in these areas of work, we have to really have our own emotional management to not have increased anxiety as we have that increase in demand, and try to manage all of that to say, how are we going to tackle this? And one of my kind of mantras in the division is, no one carries this work alone. It is a collective effort. We really have to do it together, and it has to be, if everyone can do their part, that's what we're going to ask. And there are times when we have mandatory overtime, and so we have to ask people to do a little bit more. We were very, very, I don't even know that if it was luck that we didn't have mandatory overtime this last year, but I'm going to call it a little bit of luck, because we did make a lot of internal changes to our processes that I think really did contribute to our ability to stay on top of the work, that we did not have to have mandatory overtime. And usually when that happens, our highest and busiest time of the year is November and December. So it's really hard to be asking people to do more when they want to be spending time with their loved ones and, right, holiday season, things like that. Just a nod back to the training, there's a steep learning curve in this job. And all in all, counties are short-staffed. We have, again, I don't know that it's luck or the practices and employee well-being measures that we've put in place. We have not had the short staffing issues that we've seen our counterparts to have. And I really do feel that it's related to our staff well-being initiatives that we have, the work of the peer committee that we have. I think we really do a lot to demonstrate to our staff that we know that they are whole people and they come to this work as a whole person, and we care about their overall well-being. So with that, oh, sorry. There was a question slide.
Any questions?
Thank you, Vanessa. Colleagues, this would be a good time. Any questions, comments, observations before we move into the next part of our Board of Social Services update? Yes, Commissioner.
First, just let me express my heartfelt gratitude. I'm serving on the Office on Aging Advisory Council and now as liaison, and just knowing, you talk about secondary trauma or anything. At one of my community conversations this weekend, I had two different families who were able to access Longview with their family members, and what a difference. But they talked about all the things that they had, and I spent an extra half hour with them, and it's been on my mind ever since. And so I think the constant demand comment really resonates with me, that, I feel like we all kind of feel like, since, especially with all the changes and then things with the pandemic, I'm sure that's a need to somehow manage. I don't know what the answer is there, but I just wanted to express my gratitude to everyone and all of you, because it's very clear the teamwork and the support and the collaboration between all of you to serve your whole department and serve those folks are really, hands-on, boots on the ground with the folks that we are really trying to help and serve. And I just always let us know. I know you've let us know about the programs and things you do, but please don't hesitate to voice what we can do to just help with, like, the letter and other things that we can do just to support, because you guys really are the heroes, helping those people that are in the middle of a very hard time and maybe need that little bit of someone who cares or a little bit of hope. And I just wanted to say well done and thank you.
Thank you. Thank you very much.
I believe we can now move on. Oh, I'm sorry.
I just
Forgive me.
wanted, I'll just echo the thanks that Commissioner Shattuck McNally gave. We really appreciate the work that you're doing. Vanessa would really happy, did she just?
She has her own family emergency she's
Oh,
dealing
shoot.
with today, so
Okay,
she,
okay. I was like,
She's
wow, I
sneaking
looked down
out.
at my paper and, I mean, she is efficient. It's quite clear that she's quick and efficient. Yeah, I think it's good for us to just be aware of just some of the challenges that you're facing and appreciate that. Both challenges with, financial challenges that Gordon was speaking about, and then just some of the challenges with what, Vanessa was speaking about. It's important for us to have that. It's hard to say always what the solutions are, because I know we can't sort of dictate. I mean, some of those changes come federally, and there's just not a lot we can do about it. And there are constantly changing political dynamics that affect some of those rules. But I appreciate the work that you're doing, and there again, obviously let us know if there's places we need to advocate for more funding or more understanding, especially at the state level, where I think we can have a little more influence than the federal level. We're happy to do that, because we don't want people to be stressed out, and we want people to get their services. And I know you're making sure that happens. At the same time, we need to, as much as possible, try to make this easier and better for all the folks involved. So thank you.
thank you.
Yes, and I guess I should say thank you as well. Thank you for all your amazing work. I believe now, would you like to say thank you too, Miranda?
I think it's a good reminder, right? The complex work that people do every day. We know it's hard. We know it's some of the hardest work we do in the county. And to see the systemic changes that make it harder maybe than it needs to be, the constant change, the lack of coordination, it gives a different kind of appreciation to these folks and the work that they do. So yes, thank you. Please extend all of our appreciation to them.
We will. Thank you.
I believe now we can move on to legislative update.
Yes.
Ms. Stewart.
So I believe one of the solutions is to have someone who is really well-versed and their expertise is in legislation and policy. So having Stuart join our team, Stuart joined us about 3 months ago. And so he's going to walk through also just some overview of his role, how he works in alignment with Shane Atkinson on your team. So he's going to dig into that, but then really give you a highlight on what we know to come from the legislative session this year, some budget priorities as well as bills that we are aware of, just to let you know where we're at as we are almost exactly a month into session.
And if I may, colleagues, I believe after the legislative discussion, there's still quite a bit in the presentation in terms of the other folks that are at the table. Are you allowing for time for us to s- hear that?
Yes, so we always provide you the department activity report, so it is attached to the agenda. And we should have time to pull out anything that you want to talk through in that, or answer any other questions that you have.
Great. I just want to give those folks a chance if they want to engage.
All right. Thank you, Commissioners. My name is Stuart Jenkins. I'm the Legislative Analyst with Larimer County Human Services. It's a pleasure to be all with you in this first formal setting with the Board of Social Services, and excited to be a part of the amazing, hardworking team under Director O'Hare. So, as Director O'Hare mentioned, I wanted to give a bit of an overview of my role and how I work within both the Human Services team and with Shane within the Commissioner's office. So during session, I think a lot of this will sound pretty familiar. So my job, I see it as really making sure to be anticipating, tracking, following all of the rules, potential policy changes that the state is considering, that the legislators are considering, and sharing that information back with the team to keep the team nimble and abreast of what's to come. So that's really keeping a keen focus on human services related bills, the rulemaking process, and working with the staff and subject matter experts to understand how those potential policy changes in legislation and statute or in the rule might impact the programs and staff workload. Communicating that back with our county partners, because Larimer is one voice among 64, right? And so ensuring that there is coordination, understanding with our county partners as that collective voice goes back to the state lawmakers. A lot of this work is being done and communicated out through weekly blog posts, which I'm happy to share links to and follow up. There's also a specific human services bill tracker that I have as a spreadsheet to really monitor those specific bills for the department. And then, of course, I see my role as being a resource to the three of you and our subject matter experts within the department to provide talking points and analysis and to help you be the best advocates you can for the county, for this department, in shaping the legislation and the policy that's coming from the state. So that's kind of all during session. Before and after session, most of that work will be focused on following any interim committees and coalition partners and county partner meetings to, again, track what might be coming for the upcoming legislative session. One of the constants year-round from the beginning to the end of the year is, of course, the rulemaking process and really focusing on CDHS, HCPF, and CDEC in particular, Department of Early Childhood, Healthcare Policy and Financing, and Department of Human Services. So really making sure, thank you, Commissioner Kafalis, for your service on the State Board of Human Services. So a lot of work always ongoing there, and it's great to have so many members of the team internally who serve on the sub-PACs to ensure that feedback from Larimer is really incorporated throughout the rulemaking process from beginning to end. And then, of course, this is the part that I've not participated in with you all yet, but collaborating to update your legislative agenda with Shane and the broader team as you shape that for 2025, participating in any next session preparations with county partners, and again, continuing to track implementation of legislation, rulemaking, to kind of see how there's always potential cleanup bills that we see, in ongoing sessions. So ensuring that the tracking of those programs and policy changes is in alignment with kind of those goals, and no surprises there. So that's just a bit of an overview of my role and how I'm supporting you all.
Yes, Commissioner.
Thank you, Mr. Chair. Thank you, welcome. It's great to have you, and it's really nice to hear from you today. This seems, the last couple of years in session, sometimes it feels like I should only speak for myself. Sometimes I feel like I'm on the roller coaster and I'm hanging on by my fingers and trying to just keep up with the ride. All due respect and gratitude to my colleagues at the state legislature, I know they probably feel that way sometimes as well, and I appreciate their service, but I feel for a lot of us that feel a little bit like our voices are not truly listened to or engaged. There's some things that just seem out of our control. And I know you have your association that you belong to, the state directors and all of that, but I'm wondering with CCI and CCAT, as our combined voices, trying to really emphasize some of these that we feel are really detrimental to the work that we do and making things harder. Is the collected voice and us being a little more strategic, do you think it's helping, or are we still just kind of literally hanging on for the ride? I mean that with all due respect, but I really feel like that already with this session, so.
I would say a little bit of both. I echo your feelings. We white knuckle it through session. And this last interim was a rough go as well, with the interim committee focusing on child welfare. And I do believe that it's really helping. Having Stuart in his role, he came from Healthier Colorado in his prior role, so he already had connections with counterparts in other counties. So very great relationships with other metro counties that have similar roles to his. But I also think that where we are making some of the biggest headway is really encouraging CCI and CCAT to work together. So there is quite a bit, I would say, towards the end of last session, but I'm seeing it even more this session, where they're staying in close contact with each other, thinking about strategy between the two, and connecting with each other when there are bills that they have similar positions on. But it is a really significant workload, but I do think that it's impactful. And I think that there is still opportunity for us to think about how we best prep our local delegation in the off-season. Making sure that they're aware of what's coming or what we're hearing, that we're aware of their bill priorities. I think there's opportunity to really dig into that now that both Stuart and Shane are in their roles. And we've had some of those conversations with Shane and Michelle Bird.
I would agree with your assessment. I do see a lot more collaboration with CCI and CCAT since we belong to both organizations for transparency for the public listening in. And even Friday, both groups were in the same meeting as we were discussing a bill that I think everyone unanimously in the whole room had concerns about. So I feel that's great to see because we're stronger together. And so I feel like our collective voices are maybe going to be heard better. I appreciate all the work, and I really resonate with what you said. Thank you.
So before we move on, I had a CCI-related question based on what you just shared, Stuart, and I think to some extent you've answered it already, Heather. But I'm wondering, in terms of during the interim, what is your role in terms of if the county identifies legislation that we'd like to move forward, based on your analysis, and how that fits in with the CCI timeline? By July, we have to put stuff in the little form. That's my question.
So I can answer the question based on how we've done it before. I have also had a lot of conversations with Stuart. I think he brings great ideas on how we can do things even better. So we track that, and we know that the deadline for CCI is early July. Michelle Bird then works with all of you to set a deadline, I believe, in early June, so that you're able to receive those and have some time for deliberation before the CCI process. So what we do is we track ideas throughout the year and keep a spreadsheet among our team of different ideas that come up, either from existing bills or just ideas. Sometimes we get ideas from our county attorney in child welfare in particular. So we track that, and then we have a lot of conversations internally and with the Human Services Directors Association, generally in May, early June, to say, what are other counties looking at? Is this, here's an idea that the Larimer staff team has. Is this something that we want to take on? So there's that level of collaboration too, to just gauge the temperature and see if similar ideas or discussions are happening in other counties. And then it is always, so there's our internal conversations really do stem from the workload, right? Proposing a bill and taking on that level of leadership is a significant workload, and so are we the right people to do it? Or is there another county that's already taking the lead and we can just support them behind the scenes in some way? Or is it a legal issue that the county attorney is bringing to us that, yes, we really do need to bring forward? So those conversations we always have, and sometimes we do bring ideas forward. The alternative response in adult protection is a great example, where we knew we really needed to see this change in statute, and there wasn't another county that was going to take it on. So it's just having those conversations in advance of your deadline so that then we can bring that to you and allow you all to make those decisions on whether it's something we want to move forward.
Thank you. Then a quick follow-up, then I'd like to move on, please. And that is, what is your role, Stuart, regarding participation in the myriad of county association meetings that we have, whether it's Colorado Counties, Inc., or CCAT County, whatever it is, commissioners and counties acting together. Do you attend those? Do you collaborate with Shane? How do we coordinate that to make sure we're using everyone's time
Yeah.
well? Thank you, sir.
Thank you, Commissioner, for the question. Great one. So I'm also, as we've probably seen each other now on some of these meetings, I attend all the same steering committee meetings, legislative committee meetings for CHASDA, CCI, and CCAT. So there'll be overlap. I'm there to mostly listen and capture all the details and dynamics and make sure it's kind of all that gets back to our team, and our feedback is incorporated in those comments throughout the process. It's a little bit more structured for CCI in particular, where for their bills, we get the agenda about a week out from their steering committee meeting. For human services bills on their health and human services agenda, I'll be doing my own specific analysis on those bills that'll come separate from, it seems like, the document that Shane is putting together that captures all of them in one place. So wanting to make sure we're not duplicating analysis or efforts there. So I think that's a point for that in particular, and happy to do that for the CCAT bills as well. I know they'll be taking up fewer of the human services related legislation this year, but to know that analysis will be coming from me directly and as a supplement to Shane's.
Thank you,
materials.
Shane. I think we can move on. I just want to say that your work and Shane's work, have proven to be immensely invaluable, helping us and helping everyone to try to keep track of that legislature. So it's really, I think we've added a lot of value to our effort.
Moving forward. So you've gotten a snapshot a little bit in terms of the context that changes to the budgets, how they'll impact programs here locally in Larimer. I want to kind of give an update on where the state and the Joint Budget Committee and their process is within budget making for fiscal year 24-25. So with Department of Human Services, the one thing of note is we're expecting a significant decrease in county administration funding that supports SNAP and Medicaid work. So for the last 2 years, during the post-pandemic or pandemic years, there was that annual increase, annual provision of $16.6 million statewide that went to counties. That has not been requested for the upcoming fiscal year, so expecting a decrease there. And appreciate the work CCI and CHASDA have done to advocate for increasing that funding or maintaining that funding going forward. For healthcare policy and financing, they are planning to maintain some funding to support the public health emergency workload in Medicaid, so there's a slight reduction in what we'd expect to see for the county admin sign for HICPUF, but not still more ongoing support, so not the same kind of reduction. Yes.
Just really quick before we move to the Department of Early Childhood. So the Healthcare Policy and Finance gave us a supplemental allocation, if you will, specifically for the workload increase in Medicaid. Because with the public health emergency ending and the unwind, as Vanessa called it, we have to rework every single one of those cases. Medicaid is processed annually. So in order to stay on the program, you have to go through the redetermination process every 12 months. Well, since the public health emergency spanned over 3 years, every single one of those cases is now out of compliance, if you will, with the redetermination process. So we have to rework all of them. So we do have a team of limited term staff that are focused just on this work alone and working through the Medicaid pieces specific to this funding. So the funding is slated to end at the end of this state fiscal year, and they've asked for the spend down authority to carry it into the next state fiscal year.
For the Department of Early Childhood, they've submitted a number of requests for the next fiscal year, and I want to highlight many of them in the CCAP program space. So for one of these, $13.8 million to maintain an increase in CCAP provider rates and paid absences. This was a pandemic stimulus-funded strategy that started in 2020, 2021. Maintain lower CCAP copays for an additional year for parents. And then maintaining CCAP providers for serving infants and toddlers based on enrollment for an additional year. So these are, again, two pandemic stimulus-funded strategies that they want to continue with general fund dollars. Some additional funding to support CCAP caseload increases, about $300,000, again, statewide, so not a significant increase by any stretch, but some. But I think overall, the big picture for that department and the CCAP programs is a reduction in total funds with the loss of ARPA funds. And so this goes for the programs writ large with the department.
Thank you, Stuart. Before we move on to the next slide, which is specific legislation, I'd like to pause. We can all practice our breathing and see if my colleagues have any questions, comments, observations at this juncture. Colleagues, do you have anything? Oh, guess what I do? And that is, where does the Behavioral Health Administration and the Colorado Department of Health and Environment fit into this equation? I realize it's not directly human services, but I understand that we're trying to do a better job of making sure that we see all the connections between all these issues. An example, a bill that I believe is coming up in the legislature or in committee hearing on Wednesday, House Bill 1088 regarding child fatality review. That's kind of a public health and environment thing, but it's obviously a human services thing. So how come we're not seeing BHA and perhaps CDPHE in there, and or what is the integration and working together aspect?
So it's a great question. They're not included here because we're not a direct recipient of funds from either of those state departments on this budget slide. But so for the Colorado Department of Public Health and Environment, CDPHE, they have a very active association similar to our Human Services Directors Association, CALFO, and I don't know what that stands for, but but there are often bills that might cross over human services and public health. And so we're always watching them and reviewing them. If there is an impact, then we engage. The child fatality bill 1088 is a great example. There are impacts to fatality, egregious incident processes in child welfare that overlap with that bill. And so Stuart reached out to Tom Gonzalez to get his thoughts, to also make sure it was on CALFO's radar. So it's more collaboration in the space of BHA and public health and environment, and then we just watch for specific human service impacts.
Thank you, and I presume that collaboration extends to understanding who may or may not be testifying in committee hearing, because I believe Tom has been asked by the Colorado Association of Local Public Health Officials, CALPO, to testify at the hearing on, I believe it's on Wednesday. So it must extend to that, and yes or no is fine with that one.
Yes, that's part of the collaboration.
Please continue, sir.
Thank you, Commissioner. So there was a lot of work done over the interim, as you're all familiar with, from the Child Welfare System Interim Study Committee. And I'm pleased to share that all of those bills from that committee have been introduced, and some have started making their way through the process. So first, House Bill 1031 related to accessibility for persons in child welfare matters. This expands language access resources for families, both within for services provided by counties as well as those services provided by courts. It also requires the state to create a language access plan and develop that by next year to help kind of meet any gaps or needs with regards to language access. That did pass its first committee in Health and Human Services and is sitting in appropriations now. 1038, high acuity crisis for children and youth. So this bill does a number of things, provides resources, training, placement support for high acuity youth, requires actuarial study of the reimbursement process for high acuity youth that Medicaid provides, a number of different resources, a training and academy for those that serve residential placements. That passed its first committee as well and is waiting in appropriations. That is a priority. Funding for that bill is a priority in the governor's budget as well, so we expect to see that continue. House Bill 1046, Child Welfare System Tools. This basically conducts an audit of both the risk and safety child assessment tools that the state would conduct, and then to report those results. There's also some good information that they'll collect around how the tools can better collect demographic information. So I know that that's of interest to you all. So that'll be something that we'll be watching for. That has its first hearing this week in Health and Human Services. On the Senate side, kinship foster care home, Senate Bill 8. So this reduces the barriers for non-certified kinship care providers and provides support to them by creating a reimbursement match that's lower than the established foster care rate. So to help ensure that more of those placements in the kin homes and providing that support that currently doesn't exist for those non-certified kinship care providers. That did pass its first committee. We expect substantial amendments to that bill because the funding for that is significant, and so that'll probably have to start out smaller and be scaled up over time. And then finally, Senate Bill 59, Children's Behavioral Health Statewide System of Care. So this would create the single access point for children's behavioral health services, a collaboration of the BHA, CDHS, several state departments to provide that for kids in Medicaid, uninsured or underinsured. So trying to be that one point of access and service for those kids. That is scheduled for its first hearing later in February. So happy to pause there. That's a lot.
Actually, let's keep rolling. I think there are at least two more slides with regard to relationship with the statewide associations and CCAP or something. If we can go through those, and then if we have time, of course, we'll ask questions. And then I do want to give these folks a little bit of time to give us an update on their departmental activity. Don't want Jill to get off the hook, or Laura, you that.
All right. So this just provides kind of an update on where both CCI and CCAT, since the county is members of both associations, where they stand. Thankfully, thanks to all the stakeholder work and engagement over the interim, for a number of these bills, both organizations are in support. Again, as I mentioned, CCI has taken a more active role, given their close relationship with CHASTA, for really taking the lead on advocating for them at the Capitol, while CCAT takes more of a level 2 priority to some of these bills. A couple of bills to note in the amend position are House Bill 1017, Bill of Rights for Foster Youth. So this would create, as it's in the title, a set of rights in statute for youth specifically in foster care and out-of-home placement. So there are existing protections in state statute, but this would elevate many of those protections to rights and add additional ones. What the amendments that the counties are seeking in this place are to put some parameter or limiting language around what the county obligation might be in terms of bearing the cost for some of those rights that are called for. So I think certainly supportive of the goals and the intent and to provide those services, but want to ensure that this is something that's feasible for the county to bear. And then a similar type of concern and amendment seeking to House Bill 1031 in terms of language accessibility. Some of the language in there, so this is already a requirement under federal law to provide language access services. There's certainly some stronger provisions in this plan and in the bill, but again, kind of looking at small tweaks to the language to ensure that it's implementable and feasible for counties. And then I just wanted to note the one position that CCAT's taken outside of CCI is for Senate Bill 40, and that's state funding for senior services. Since all of the supplemental bills did drop last Friday, One update to this is the JBC did pour forth a supplemental of $2 million as a contingency fund for AAAs in the Office on Aging to help reduce the wait list that they heard about in a briefing a couple months ago. So, all right, my last slide. So, oh, yes.
Just want to clarify if I could, Mr. Chair. You said 2 million statewide for all the AAAs?
Yes.
That's it? Okay, that's better than nothing. Okay, thank you.
I'll just note on that, the CDHS did bring forward a request for information in response to that to the JBC. It would be 5 to 6 million to reduce their wait list statewide. So something towards that effort. So there's a lot of potential legislation we'll probably see, and there'll be a bigger update, I'm sure, to provide in May or when we all meet again. But I think one thing that we're really watching for and engaged with within our team and with our county partners is potential legislation related to the Child Care Assistance Program. So there have been a couple of proposals now combined into one from advocates that seeks to simplify the application process, streamline eligibility for folks in the program to make it presumptive, and potentially expand it to include those for in substance use disorder treatment. And so some of the proposed policies, this is not extensive, but we have fact sheets and additional information if you're interested. So one, requiring only necessary information for the initial application and redetermination, establishing a statewide uniform application process, which we know has been in conversations within the Department of Early Childhood since its beginning. Again, this presumptive eligibility for families if they meet the minimum federal requirements and can simply self-attest to that their information remains the same at redetermination. Increasing eligibility to cover child care workers, and I mentioned the SUD treatment as well. And then limiting parent co-pays to 7% of a family's income. So it's also working to try to get ahead of some changes in federal rule that we expect will come this spring. So that 7% one for co-payments is an example of that, where again, we'll just kind of see what the federal rules are. So I think there's a number of laudable goals within this legislation that we would like to see, especially streamlining the redetermination piece. We've learned from our team internally that application is 30 pages to go through the redetermination. But I think there's really an opportunity to both educate sponsors and advocates around the value of the information that we collect at the initial application stage does serve to make it easier for families to get access to the care later on. So I think that will just be a big one with significant impact to CCAP in particular. So just wanted to highlight that for you all.
Thank you, Stuart. Commissioner Stevens.
Yeah, thank you, Stuart. Thanks for the rundown of everything. With this, I love the idea of streamlining eligibility and expanding eligibility, but if you're expanding eligibility in a program as ours that doesn't have enough funding for it, it's great that more people would be eligible for a program that's been frozen. For us, is there any idea that there might be more funding coming? It sounded like maybe not with the earlier slide. So, how does this help us? There again, I'm grateful, for that people might not have to fill out a 30-page application, but, we don't have funding to begin with.
So there is, as Stuart mentioned, there is a request to add to the base allocation, but with the loss of the stimulus funds, the ARPA funds, it's not going to be a total overall increase. So that is the challenge. And so we don't have any bill language on this yet, and the devil is always in the details of legislation, but we've really been trying to dig in. Yes, there are things within the eligibility realm that could be simpler, but we often are gathering more at the eligibility stage so that we can also authorize care right in that moment, not have multiple steps for a family where they have to apply and then we say, okay, great, and now we need this information to know how many hours you were authorized for. We try to lump it all into one stage for the family. So I think clarifying that for the advocates is going to be really crucial when the language is available. And This program is very different in that it is one of the only programs that I can think of off the top of my head where the benefit goes to the childcare provider, not to the family. We're paying the provider. And so there's a process to make sure that we have those providers under contract and that we can get the payment to them as quickly as possible. So there's just some details that I think we'll have to wait and see what the bill language actually says. But Stuart's been participating in a work group with a handful of other counties, really trying to get ahead of this. And he was just meeting with Vanessa and her team late last week to really dig into the process details so that we can be as prepared as possible when it does come.
Thank you.
Thank you.
I'm sorry, one additional thought. So the state departments, and this strategy existed when this program was administered by CDHS, and it is continued now with the Department of Early Childhood. Their thought always has been that with greater wait lists, we can better demonstrate the need to the legislature. Yes, that is true, but it also puts counties in a really difficult position when we're the ones that have to communicate to the community and to the families we serve why we're on a wait list or why we're on a freeze. So it's trying to also make sure that we have the data to justify more funding.
Okay, yeah, that makes sense.
So, Stuart, well done. Thank you very much. I'm going to have to hold off on my questions. I'd like to move into departmental activity, and I'm going to suggest something a little bit different since we only have about 10 minutes because we're supposed to be across the street, at least some of us, at noon. And that is, for example, when we get to aging and adult services, perhaps Lori could tell us the top 2 takeaways from these slides, and we could do that with child welfare. What's the most important stuff for us to know, top 2 takeaways or something like that? Give it a shot.
Thank you. Again, Lori Metz, Division Manager, Aging and Adult Services. I would say the biggest takeaway, all in all, is the significant number of referral increase from Q4 of 2023 to the most recent. Kind of that year piece there that you'll see, that they are just taking so many more referrals in APS than they have in the previous year on the same quarter. So I think that we're actually seeing probably business return to normal is what I would say, that it's, we saw a high number of referrals early on in the public health emergency and adult protection, as, people weren't able to provide services in homes and things like that. So we were kind of that emergency crisis call. And then we saw things fall off quite a bit. And then we saw a large spike when people started returning to doctors' offices and accessing services in the community again that maybe they hadn't been taking care of themselves during some of that time. So I think we're just kind of seeing a settling out there. But as you'll see, our percentage rates when it comes to assigning for assessment stay pretty consistent there. And I have one more.
You're working on your second
I
key
am.
takeaway?
I am. 1 second. I just wanted to point out, so it's on the 5th slide, about the long-term care ombudsman program when it comes to their open cases. This slide, thank you. So we did have a change in a data system. So that's why some of those numbers look a little off from the Q4 of 2022 in comparison to Q4 of 2023. So how complaints and how those cases with open cases with facilities rather was documented changed quite a bit when we had a new system. So when you see that change, that's why.
Thank you, Lori. I believe the next category is benefits.
And we can skip that. Vanessa already gave you her update around Medicaid and SNAP. That's really the high points for benefits and community support. So we can go to child welfare.
Thank you, Heather. Yes.
Division Manager for Child, Youth, and Family with Department of Human Services. I think my only way I can minimize mine down to 1 slide is it's a volume thing. We are having an increase in referrals, so we are going to have increases in cases. There's always that little bit of a lag that continues to happen from high referral volume that turns into cases 60 days later. So we are on a path this year to have a higher number of referrals and assessments this year than we did last year, as well as a higher number of children open to cases. I would also highlight, and I don't know that any of the slides specifically calls this out, but the high acuity bill that was addressed in the legislation is a reality, and it's not just youth and high acuity youth in crisis, it is a high acuity families in crisis. So it is parents have high acuity needs as well. That is part of the reason why our core services budget is so overextended, is that there is a lot of need in the community. And in addition to that, we have legislation from last year with more increased visitation, parenting time, which we are in full support of, but there are a lot of costs that are associated from both a workload and a cost to do those. So the needs are real, very, very real. I think the articles in the newspaper on the Longview campus explosion when it opened up is the reality of what my staff live every day, and I think that high acuity is real in every case that we have.
Do you have a second key takeaway? You get to have to.
I combined a bunch that were not even on the slide. So
Why
I
do
think
we
I can
continue
pass
to
it.
do so well with out-of-home, in terms of our minimum percentage of out-of-home placements?
Yeah, so we continue to have the same percentage of, compared to all the other big 11s, we have a high level of percentage of placements that are in kin. The legislation that is coming through this year, there's some worry with that legislation. I am in full support of the legislation, but there's a pretty significant cost to that will not be provided for, and that will have an impact on our community. We do a lot of kinship placements with kinship families that are given temporary custody. This new legislation this year is intended to help pay for some of the daily rates for that kinship placements, and that is a cost that we don't currently pay for, and we will feel fully if there's not support from JBC. You'll notice on the out-of-home placement slides, we continue to have one of the lowest congregate care placement rates than anywhere across the state, and we are a high utilizer of kin placement. Our goal is still to get to 85% in kin, and we're still hovering around 65% of all kids that are in some level of non-parental custody placement are in kin. Our goal is to get to 85% still, so we're working towards that.
Thank you very much, Thad. May we move on now to the last category, Human Services Department Service Provision. Is that Jill?
This is actually Gordon.
Oh, what about Jill?
Jill's team puts this whole slide together, and an update that we should give you. So we are transitioning this to a Tableau dashboard, so that it is available more in real time. And we're really trying to determine what we might be able to share then out publicly and have a dashboard that we can sync up with the health dashboard that came out of your strategic plan, but also to just have this data on hand in a much more nimble fashion. So Jill's team actually spends all of the time to put this data together.
That's great, and perhaps periodically you might remind us about this additional human services-related dashboard. Is this integrated into the Community Health Wellbeing Resiliency Dashboard? Is that what you just said?
It isn't integrated today. There are some manual processes in that we're sharing data with Jared Olson on the health team so that it can be embedded into Health's dashboard. As we try to figure out how we can publicly release data that has a lot of protections around it.
Great, thank you. Gordon, I believe you're on. Key takeaways, one or two.
I think, well, so this really represents the work that our care team does in supporting the different contracts of the different programs. I think one of the things that we are working really intentionally with the care team is actually looking at where we can cut costs, where we can reduce some of those costs, and consolidate some of those costs, working with the other divisions. So you're seeing a little bit of a decline there, but really just trying to be intentional about how we're spending money.
So your main message is that we continue to cut costs, be more efficient and nimble, is that correct?
That is a great way to sum it up.
That's a good message. Thank you, Gordon. Well done. Thank you, Jill. Heather, is there anything else you wish to share? Otherwise, I believe we'll move into closing.
I don't think there's anything else for today.
Thank you. Colleagues, any final comments, thoughts before we adjourn? Yes, Commissioner Stevens.
Just thank you. Obviously, these, slides and the presentation today indicate how many challenges that you have in doing your work. And so we're really grateful that you and everyone on your team keeps doing that important work in our community. And we are always available to help testify or whatever we need to do to try to address some of those challenges you're facing, because we do appreciate the work that you're all doing. Thank you.
Thank you.
Commissioner Jody, Commissioner Shaddock McNally, excuse me.
Thank you all. I think I already expressed my heartfelt gratitude, and I'll repeat what County Commissioner Stevens says. Let us know where we can help, whether it's one-on-one meetings with our colleagues or at the Capitol, or how we can address these issues. And I feel you guys are always so busy, and I know we just asked you to maybe track some things, but it just helps us when we have some of that information in our back pockets. I hate to ask you to do more, but it just, if I can pull out stories or numbers when I'm in the hallway sometimes somewhere, it's just really impactful to rattle some of those, not rattle, but state clearly the need and the challenges and what is really being impacted. So I appreciate you all. Thank you.
Thank you.
And I too appreciate all your good work, teamwork, and you're probably grateful that there's no time for me to ask my devil's advocate question. But I'm hoping appropriately we could do some kind of follow-up. Heather, I had a couple of questions, but we'll just have to wait.
Okay. We can connect
Thank you
offline.
all. Therefore, at 11:56 a.m., we are adjourned.
Thank you all.